In medicine, we are constantly faced with uncertainty. Take diagnosing a fever. It could be anything from a simple cold to a life-threatening infection to a blood clot to even metastatic cancer. The possibilities are infinite, and the process of trying to figure out what's going on and what to do can be overwhelming, anxiety-producing, and even exhausting. All the conditions for burnout. So how do health architects cut through the noise to figure out what to do next? This is where evidence-based medicine comes in. Health architects use evidence to follow a stepwise approach. First by asking what is plausible, and then what is probable. Let's go back to our example about fever. Sure, infection and cancer are equally possible, but are they equally plausible as well? Let's add some contextual clues based on evidence. The patient is 30 years old. She is a woman and is otherwise generally healthy, except for some minor scrapes she's had over the years. Given this situation and the details provided, an infection is much more plausible than cancer. Plausibility helps us filter out what is unrealistic and stay focused on what fits the situation. But plausibility alone isn't enough. We need to take it a step further. That's where probability comes in. With evidence in hand, we can weigh the likelihood of different plausible scenarios. Take our example of the young woman with a fever. An infected ovarian cyst may be equally plausible to a kidney infection, but if we add other findings, such as a significant amount of white blood cells in the urine, and a CAT scan result that shows stranding around the kidney without any involvement of the reproductive organs, including the ovaries, then what we know from the evidence, both causally and mechanistically, favors a kidney infection to make it much more probable than an infected ovarian cyst. From the wilderness of possibility, plausibility narrows our focus and probability lights the path. But we need it for another reason. And this is how we can circle back to our discussion about burnout. By focusing on plausibility and probability, not just possibility, we can combat burnout by conserving our brain power, reducing our anxiety, and increasing our confidence and sense of control when we make decisions to help our patients. We don't ignore the unlikely possibilities, but we don't let them distract us either. Evidence-based medicine is not just about crunching numbers and doing cookbook medicine. It's about clarity. And in a complex field like medicine, the clarity is everything. We also can use evidence to connect with those around us because we can speak a common language around that evidence and not just rely on our personal anecdotal experiences to back up our clinical rationales. Evidence is a strategic tool in our fight against burnout. Want to learn more about how to overcome physician burnout by becoming a health architect? Subscribe to my Substack for deeper insights.